So, sir, what are the different ways in which optimum sterilization can be maintained in a dental setup?
This is an elaborate question. What I will do is I will divide into two parts. One, I'm going to talk about the sterilization of the instruments and the equipments. The second one, I'm going to talk about the sterilization and the hygiene maintenance of the clinic and the adjacent sites of the clinic. The first thing is I want to talk about the instrumentation, the sterilization techniques. See, there are different instruments and armamentarium you use in the clinic, especially like the plastic instruments or the filling instruments, what we are using. We cannot directly use all the corrosive substances because it can corrode, it can tarnish them, as well as their sharpness will go off. So normally what we do, we do a cold sterilization in which we use sterilium, or we are using a surgical spirit, wiping off the instruments and cleaning those instruments properly and storing them in a UV chamber or in a formalin chamber, so that the sterility of the instruments, whatever we are done, it is maintained. Because the filling instruments most of the time doesn't contain any blood or the particles of the bone or the tooth particles, other than the saliva something and the little bit of the particles left over. Once they are cleaned and kept it out, those instruments are done. But there are other instruments like when you're doing for extraction, forceps, the knives or the blades and the needle, those things, the needle and the blades are the disposable, you dispose it off. So you don't have to do cleaning of it. But the forceps and the aerator instruments you have used, those have to be cleaned. But you cannot directly clean into the sterilization. Normally, what has to be done is the extraction or the surgical instruments which has been used has to be soaked in a cursolic solution about 20 to 25 minutes after the treatment is done, so that whatever the dirt particles or the blood, this mucus, so all the other things are, they would have got hardened up. So what will happen? It gets softened up and it gets removed. After that, you need to wear a proper rubber gloves for the cleaning of the instruments, because nicely scrubbing and cleaning of the instruments, it will help in the removal of all the debris, because the instruments have serrations, and these serrations have got the depressions where the blood particles or bone cut particles or a saliva can be embedded and the bacteria and get stored there, or virus can be sitting there. So it has to be nicely scrubbed. Once the scrubbing is done, you need to use the what you say is the ultrasonic cleanser, where you put those instruments in ultrasonic cleanser. What will it starts a vibration in such a way that all the instruments, whatever is cleaned, also if some of the remnants are left over, it will be nicely dispersed out and it will be clean. Once you remove from that, nicely wipe it, keep it dry, and then you have to use the autoclave. Matlab, the instruments have to be autoclaved. The best option to do the autoclave is the using a pouches, or you can directly do with a surgical cloth. But I will advise you all to use a pouch, because the intensity of the autoclaving, as well as the vacuum temperature which maintains, as well as the drying cycle which happens in the autoclave, it helps in the maintenance of the shelf life of the instrument also. Second thing, good penetration will be there by the hot air, as well as the autoclave sterilization will happen much more better in that way. Once the sterilization is done and the instruments are dry, but you have to make sure that once these instruments are dry, you just cannot keep wherever you want, because in the clinic you have a little space to work and you have the lot of aerosols liberated. You have to make sure that the autoclaved instruments have to be stored in a clean and dry environment, and most of it should be in a cabinet. So you should make sure that in a UV chamber or in a nicely cupboard where you can keep all these sterile pouches, and whenever you want, you can take it out and use it. But it has to be used and then later on go for cleaning again. That's how the sterilization through the autoclave is the best technique now also. And the other one I want to tell you about is, if at all you have a handpiece sterilizer with you, it is one of the boon for you, because after each and every case, it will take a lot of time and cycle for the autoclave to autoclave the instruments and come back. And if at all you are using air rotor, micro motor, and hand pieces, if you have a hand piece sterilizer, it is fast and you can get the hand pieces sterile in a faster environment. Second thing is the cleaning is much more easier in that. The equipment sterilization also I want to tell is, lot of equipments are plastic instruments and they are having electrical connections. So you cannot use the materials which are being using for the floor or drainage cleaning, all the other instruments cleaning material, because they are corrosive. So they will disturb and damage the equipments. So you need to use wet wipes, which are very good sterilizer for the equipment, because they are one of the best EPA registered hospital disinfectant, like Sporidex or Cursolex or whatever the new brands are available. Use it because it helps in removal of HIV, even the other hepatitis viruses, the normal COVID-19 viruses, bacteria, everything from the surfaces of the X-ray machine or the light cure equipment or the root canal rotary instruments. All those things you can do it. The next part I want to talk about is clinic sterilization. The clinic sterilization starts from the patient entering your clinic to the time the patient goes out of your clinic. This is a big cycle, everybody knows, but the way it has to be done is very much important. The moment any patient is walking into your clinic, make sure that you have a complete protocol setup. Like the patient has to be wearing a mask all the time. He should be wearing a gloves in his hand, the new one which you can give it when they come into the clinic. If you're able to give them a footwear, or if at all you can give a shoe cover, that's going to be very good boon for you, because the cleaning and the what is the sterility of the clinic can be maintained. So once the patient walks into the clinic, once you start with the procedure, everything, make sure that most of the disposable things are used for the treatment, like a disposable drape or the disposable cover on top of where instruments you are going to keep, because all these are going to get contaminated. You can just throw it out. Especially the light handles and the chair handles, you can have a wrap done, so that the moment any patient is finished or the treatment is over, you can just throw that wrap, and it will be easy to maintain the sterility of the chair and the other equipments in the clinic. But once the treatment is done, your floor and your walls or your cabinet surfaces and all is not clean. So you have to use the materials like a EPA registered disinfectant to clean the wipe the surfaces of the cabinets, table, everything. And the floor, definitely you have to use sodium hypochlorite 0.1%, and nicely clean and wipe the surface such a way that no remnants are left over, and you need to allow it for it to dry. Once the cleaning of the floor, everything is done, you need to at least wait for about 10 to 15 minutes for any new patients to walk in. Why we advise this? Because by the time you do the cleaning and removal of the instruments, it will take time. One. Second thing is, once you remove all those equipments, materials, everything, and do the cleaning, you should allow the cleaning surface, what are the cleaning solution also, to remain in the surfaces for some time, so that the disinfection action is done. And the third thing is the aerosols, all the substances in the clinic, it will remain for some time. So I will advise everybody to have a HEPA filter, because these new HEPA filters are very, very helpful, because it helps in the removal of the air and purify the air in less than 6 to 10 minutes. Because each cycle is about 6 to 8 minutes, it can change the complete air in the clinic. So once you know that the cleaning of the air is also done, and you feel now there is no odor or no smell, and the clinic looks to be absolutely new and sterile for the next patient to come in, that is when I advise the next patient to be taken. The other most important things to be taken care is like the drainage system. You should have a proper drainage system, because whatever the treatment we are doing in dental, lot of contamination of blood and saliva will always be there. So that has to be nicely flushed and cleaned in such